I think the patients need to do what they are comfortable with. Everybody needs to understand that maintaining your health and maintaining physical activity through these very difficult treatments is actually very important for a good outcome. It actually raises your spirits. It kind of keeps you sane as you're going through all these treatments. And it also, I think, in my mind, has a positive effect on the immune system, on everything else in your body. And trying to figure out the best way to do that, I think it's very important. And if in that context, pulmonary rehab is helpful, I certainly am happy to refer people to pulmonary rehab in this context.
I would say we've underutilized pulmonary rehabilitation, and maybe we're babying our patients a little bit, but I fully agree with what Tobias said. It's extremely helpful. It's non-toxic. It's generally reimbursed by insurance companies, and it can be extremely helpful. The other part of it is that it's often sort of group therapy. So when you go to pulmonary rehab, there are often other people going through the same process, maybe not all who are recovering from surgery or treatment for mesothelioma, but all who have some impairment in lung function. And there's some benefit to supporting each other during that process. So I think that my patients who have gone through pulmonary rehab enjoy it. Part of it is it gets them out of the house, and doing something and being active and being part of the community.
Yeah, maybe giving a little bit of a control back to a patient.
It's actually, and we are trying to expand this into mesothelioma. We actually have a very active program at our institution that's actually focusing on the rehab aspect, but then also of self-empowerment of patients, where you actually kind of take control of your disease and you actually actively are involved in the care, but also actively are involved in doing things in your activity during your daily life and activity of daily living. And that's actually been very helpful for other patient groups already. So we hope that this will also translate into help in the mesothelioma community. But for instance, the chronic obstructive pulmonary disease, it's actually been very helpful beyond just the physical exercise part of this.
And I'm also wondering, cough, chronic cough seems to be such a complaint in this community. Tricks of the trade, first of all, what is chronic cough? What is the cough? What are the underlying causes of the cough? And then maybe what are some of the remedies that are used? And I know I'm asking, it's a wide open, I know there's a lot of different reasons, but if you can go into some of the basics of what the most common causes of cough in a mesothelioma patient.
You have to understand that I think it's easier to treat mesothelioma than it is to treat chronic cough. Chronic cough is I think the most difficult diagnosis that a pulmonologist has, and we often dread when a patient comes in, especially when they've been through multiple other physicians first and then they come to you and they've had exhausted workup. So in the context of mesothelioma, the chronic cough can be from